guys, I'm going to try this one more time. She's getting the invite, but I don't know what's going on. It keeps disappearing. Again. There we go. Yay! It works.
Yeah,
How are you?
finally.
Good morning. Yes, no worries. I was sending it a couple of times. I don't know what happened. Good
Yeah, I got it
morning.
and it disappeared. I don't know what happened. Can
Okay.
you see me
I
fine?
can see you. I can hear you. You look great. Awesome.
Perfect.
Okay,
Perfect.
so I thought we'll just start, and I know we're like 2 or 3 minutes late. I'll just start with a little introduction about me, introduce you. You can tell a little bit about you, and then we can get right into some of those questions.
Awesome. Yeah.
Awesome. And so, again, my name is Dr. Ida Khanum. I am a concierge pediatrician. I have a small boutique concierge practice here in Bel Air. I've been a pediatrician 20 years. My practice is about 10 years old. It's called Pediatric Pod Concierge Pediatrics. Again, small boutique membership based practice. The focus is providing personalized care, giving parents premium access. They get direct text access, and they love the fact that it's very price transparent, so very affordable. And then two other things that I do are autism evaluations and ADHD evaluations. And this is Autism Awareness Month. And so I thought this was a great opportunity because I get a lot of families when I'm doing their evaluations have concerns with sleep. And so I thought it would be great to invite a sleep consultant on to chat with me. And thank you so much, Alejandra Zuniga of Easy Nights, sleep consultant. Please go ahead and tell us a little about you.
Well, yeah, thank you for inviting me. We were talking about this earlier this month. Autism is a important topic, and I feel like families with autism does not have, so many resources like other families do.
That's right.
So I'm glad you invited me to share with you some insights about sleep. And yes, before we start, my name is Alejandra Zuniga. I am the founder of Easy Nights. I am a certified gentle sleep coach, and my job is basically just I work with families around the globe. That's the beauty of remote work, to
Yes.
help them find the right solutions to fix any sleep issues their children may be having. My focus is on babies from newborns to 5 years old, okay, babies and children until 5 years old. And sometimes I have worked with families with children with autism. Autism is not, is not a disease. Autism is just a different kind of, children with autism, people with autism just have a different way. Their brain works in a different way.
That's right.
So especially them, they need a tailored, personalized approach to help them find better sleep,
That's right.
right? And
Yep.
fulfill their lives better.
Yes. No,
Hmm.
that's very right. And I think both our goals are kind of similar. We run our practices very similarly. Our goal is really to kind of cater to a very individualized approach. And I think that has been the thing, with this week also, I had a couple of kiddos that I did the evaluation on. And one of the big things that comes up repeatedly is most of the children on the spectrum have issues with sleep. And there are different problems that they may have. And so I kind of came up with a bunch of questions.
Sure.
And, again, the chat is open. So if there are any families following us or
Please.
watching the live event, if they have
Hmm.
questions, they can put it in the chat and I'll try to kind of watch and answer those questions. But I think these are common questions that come up, and that's why I kind of came up. So we'll get right into it. And so, I was thinking, number one, what type of sleep problems are actually common in individuals with autism? What have you seen? What are the
Hmm.
concerns that usually families will bring up?
Yeah, so the main concerns are they all start with difficulty falling asleep. Okay. For some reason, individuals with autism have, I think, neurological differences, and their body cannot produce melatonin the same way other people get their melatonin, or they have low production, and then so they have difficulty falling asleep in the beginning of the night. That also brings, like, for example, for preschoolers, that they have to wake up early in the morning. They have short amount of sleep during the night, and then they are sleepy throughout the day. And so their sleep-wake cycles are kind of unpredictable.
Mm-hmm.
Okay, one night could be great, but then the next could be different. So it's a little bit about, irregularity when it comes to sleep, restlessness, some even, go on to having parasomnias, like, sleepwalking or night terrors.
That's
And
right.
so exactly each uh, issue needs to be treated differently, or needs to have a different approach, right? Or strategy.
Right. Like this week, my family that I spoke to, I think the father was, he said, my child sleeps at 10, will wake up at 8.
Mhm,
But if for any reason, if he has a nap in the day for even like 20 minutes,
mhm,
he just cannot go to sleep at night. And it's like then
mhm.
he's up pretty much through the night and then he'll fall asleep at like 5 or 6 in the morning because he's so exhausted, even if he had a little power nap in the day. And so they kind of figured out with time that power nap for some reason does changes something with
Didn't work.
him, and
Hmm.
he is not able to fall asleep. So their goal has really been not to let him nap in the day, so that way he at least gets to go to sleep, or at least he lays down to fall asleep at 10. It takes a little while for him to fall asleep, as you said. I think some kids take a longer
Hmm.
time to fall asleep. Some
Hmm.
may have more wakefulness, like restless sleep and waking up and sort of shallow sleep. And then I think there are some kiddos, and I've had one or two of them where they're sleeping a lot. So
Yeah.
it's like the opposite. It's like the
It
opposite.
actually, it's the opposite. Then there are kids that go to sleep easily but wake up super early,
Yes,
or they have fragmented
sleep. That's
sleep.
right.
Also, that happens. They wake up in the middle of the night, need to have 1 or 2 hours awake.
Mm-hmm.
Some people even say like they need to play, like they need to be active, and then they go back to
Sleep. Yeah.
sleep.
Yeah.
And so sometimes, if that works, like for the family you were talking with,
Yeah.
not having a nap, even like that 10-minute nap or 20-minute nap, can affect. And in a regular kid, it sometimes a naps, depending on the
Right.
age, can affect the night. So it's especially important in children with autism, to learn to get to know them and what works for them
That's right.
specifically,
Yeah.
and then help them. It is normal that we all sometimes, have dips of energy throughout the days, so
Mm-hmm.
throughout the day. And so it is normal that maybe a kid, feels sleepy and wants a nap, but, if it doesn't work for night sleep, then it's important for the parents to, have a strategy, have, a consistent activity maybe the kid can have at that time, get a
Mm-hmm.
snack, a special snack,
Yeah.
so he doesn't actually take the
Fall
nap,
asleep.
right? Even if they are at the school, communicate with school that
Yeah.
this kid, you know, actually doesn't need to take a nap, and maybe they can offer something different for him to do
Yeah.
at that time.
I think that's really important
Hmm.
because again, I think what we're trying to really sort of emphasize is that no two children are the same. So you may have one child, and just like
Hmm.
all of us, all our children are no two children
Yeah,
are the same. Actually, I think in the
exactly.
general population,
Hmm.
I have a child that loves sleeping, and at 8:30 he'll go to sleep, and I have another
Hmm.
one who has FOMO. He feels like he's gonna miss out, and he can be
Just
up to
stay
midnight,
awake. Yeah.
even though
Uh-huh.
there's nothing going on. And so I think just in general, all of us have different sleep patterns and different needs, and sort of realizing what works for your child, I think, is really, really important. And I think all in general, parents sort of
Hmm.
kind of need to work. And that's exactly it. I think that family kind of realized it was the nap that was causing the issue of nighttime sleepfulness. And
Hmm.
he still has a hard time falling asleep, but at least when he doesn't have the nap, he's sleeping for the 8 to 10 hours. And
Hmm.
again, with him, with that particular child, if you wake him up before he wakes up on his own, it's a
Hmm.
bad day. And if he wakes up on his own, it's maybe he's had enough rest, and it's a better day. So, again,
Yeah.
another strategy. And so, when you have school going children, I'm sure that's something that you tell, that if you know how many hours, and that's one of the conversations I have a lot with my families, figuring out how many hours of sleep does your child really need, and then figuring out
Hmm.
bedtime according to that. Because the morning time when you have to go to
Yes.
school has to be a set time, right? So then you have to push back or bring your nighttime bedtime a little earlier, which can be hard, which really can be hard for
Sometimes,
some families.
yes, because also children with autism have trouble sometimes with transitions.
Yes.
So you actually have to prepare them, have a very regular routine
Hmm.
that helps them, produce that melatonin when they need to produce it.
Right.
Okay. And that starts from when they wake up.
Right.
Sometimes, just changing things that happen in the morning for a child
Mm-hmm.
can help them regulate their circadian rhythm, produce the melatonin that they need
Right.
at that time that they need it to happen. And sometimes it's hard because, it gets dark really late
Yep.
here,
No,
right?
that is very
And
true.
so sometimes parents need to work with the whole house, like make the whole environment conducive to sleep and start introducing some cues
Mm-hmm.
to the child that sleep is coming, right? And so, especially in children with autism, it's really important to have a routine throughout the day, not just their bedtime routine, but so they know what's going to happen, can anticipate what happens, have an easier time with the transitions,
Right. That's
and
very true.
be ready to sleep when they need to be. But also, again, because of their neurological differences, sometimes even though they have all of that, they still need extra help,
That's
right?
right.
Hmm.
I have a question actually, someone has put on what
Yeah.
can help with fragmented sleep at night? Any
Well,
suggestions?
with fragmented sleep, usually what helps is actually having a later bedtime and an earlier wake up time.
Mm-hmm.
So the sleep can be more, compact
Mm-hmm.
at night.
Mm-hmm.
The child probably will have less sleep time overall throughout the night,
Mm-hmm.
but it may help to, make it
More concrete.
uninterrupted.
Oh, yeah.
Exactly, to make it uninterrupted. So it also depends on the age of the child, kind of figure out what's the best time for them to go to bed. But as you mentioned before, the figure out what time he needs to be awake in the morning
Mm-hmm.
and then work around that. If the child usually has 4 hours of sleep, then wake up and then has another 4 hours of sleep, then calculate 8 hours
Yeah.
to, for bedtime, right? Depending on the child, I work with children until 5 years old. Usually for children up to that age, they need around 10 to 11 hours of
Wow.
night sleep, right?
That's
Eight
right.
hours sounds
Little
little for, but it could have, like, maybe that's what
he
they
needs.
need.
That's right.
Exactly, that's what the child needs. And that's also, that's why it's very important also to find the right plan for your child.
Right.
Hmm.
Yeah, I think that's the important part about trying to figure out what does your child need and what helps them
Hmm.
function well. Because I have seen children who sleep a lot, but they have long hours of sleep. But if their sleep isn't they're woken up a little early, their day
Hmm.
is bad.
Yeah.
Versus someone who gets a full night's sleep, they function much better. But I do agree, and
Hmm.
I think there are days that some children do better, and some days that they do worse.
Hmm.
And you kind of have to kind of come up with sort of a good happy balance. But a question that I
Hmm.
had is what ideas would you give for
Hmm.
families to kind of create that nice bedtime routine? So you have a child that typically has a hard time falling asleep. I mean, what would be cues or things you could do, suggestions
Yeah.
for those families?
So for children with autism, it works to have visual cues. Okay, so maybe working on a chart, maybe graphics, and make it like a kind of like a game
Same.
that he has to, they have to do all the steps,
Mhm.
right? And so having maybe it can be, for example, a bath time. Then they brush their teeth, they go and put on their PJs, then there's story time, and then maybe a special ritual, maybe a special song. Knowing what their bodies need to do is also helpful because, again, um, they don't read social cues the same
Mhm.
way other
Yes.
people read them, right? And so sometimes they can feel tired, but they don't realize what that is. And so just narrating that, that feeling, my body feels tired, um, it's time to sleep. Maybe make it a rhyme,
Right.
right?
Mhm.
My body feels tired, it's time to sleep, that the lights will go down and I will close my eyes and go to sleep
Mhm.
or something like that. We,
Mhm.
every family can have something special for their child, or make it a song or something that they like.
Yeah.
They can even have maybe a security object can be helpful for them.
Mm-hmm.
A fidget toy
Mm-hmm.
for usually helpful for them because they get distracted sometimes and they need to focus, right? We need to help them focus on their body and relaxing. So sometimes fidget toys help them. And so that could be helpful for children with autism. Instead of a security
Mm-hmm.
object that a regular child has for the texture, a fidget toy can be helpful for them. Weighted blankets
I was going to say,
also,
that's right.
because they have also usually they have sensory issues, right?
Yeah.
And so making the environment, that's another thing. So if it's a weighted blanket could help, or really tight pajamas,
Mm-hmm.
or on the contrary, loose pajamas. It depends
Right.
on the child, right?
Yeah.
Um, a red light, something for them to realize another
Cue.
cue,
Right.
right? That it's time to sleep. Block out
Yes.
noises if they are
Sensitive.
sensitive to sounds. Even block out any lights, blackouts, cover the windows so there's no light coming. Also, that will help their circadian rhythm realize that it's nighttime,
Right.
and ideally help with their sleep-wake cycle, know when to produce a melatonin, and all those things. A massage,
Yeah.
yeah, a
Prepare for the
massage.
downtime. Yeah.
So a routine for a child with autism can be a longer
Mm-hmm.
one because they need also like timers. Sometimes also they need timers. They need to know how long each activity lasts, right?
Yeah.
Again, it depends on the
It's a
on
cue.
the child
Right.
because the spectrum is
Why?
wide, right?
Yes,
So
that is right.
some
Yes.
babies, they don't need a lot, but others they do.
Yep.
They're all children. Usually, autism comes with
Mm-hmm.
ADHD, for example, right? So
Mm-hmm.
for older kids, you need sometimes help them
Mm-hmm.
focus. Uh, a story, visualization, just talk about something positive,
Mm-hmm.
a place that they like, and so their body can relax.
Calming.
Just think about one thing, specifically, and do the ritual song, and then lights off, and
And then go with
good
that.
night.
Yeah.
Ideally, good night, right?
Yeah.
But yeah.
It's the process. No, that makes a lot of sense. And there's a lot of these strategies we want every parent to do with their child because I think
Hmm.
children, again, as you mentioned, I think that's something that we talk about with all my families when I have them in my practice. When we have
Hmm.
their checkup, I kind of talk about the whole sleep routine because I feel like sleep is so important.
Hmm.
I tell the kids actually specifically because a lot of kids want to be tall and
Yeah.
healthy, and we're like, okay, you know what? Remember your growth hormone? You grow in your sleep. So if you're eating well and
Hmm.
you're sleeping well, you're going to grow well and you're going to stay healthy. So across the board, we want to make sure they're having a really good sleep
Yeah.
routine. But a lot of times,
Every
parents
child. Hmm.
don't realize that. And another two things that I actually mentioned, and I'm sure you agree with, is food, making sure they have had a good nutritious dinner. I
Hmm.
do recommend high protein dinners usually because sugary things will make you hungry sooner. So I do
Hmm.
recommend trying to get like a proteinaceous meal at dinner time.
Yes.
Now, again, kids on the spectrum may have food specifics,
Yeah.
concerns. But again, trying to get the protein in versus a carb or a high sugary meal, I think
Hmm.
helps. And then screen time limitations.
That
I
that
think
I was gonna say that.
yeah,
That reminded
right.
me.
Yeah. And sort of limiting how much they do. I usually say about a couple of hours before really to not have anything. Because I think the goal at the end
Hmm.
of the day, both of us are trying to kind of get them to calm down. So with the kids on the spectrum, it's sort of cues,
Hmm.
even all children, it's like cues. Some need visual cues, some need verbal cues, some need
Hmm.
environmental cues, some need a mix of it all to kind of help them calm down and wind down so that they now know it is bedtime. And I
Hmm.
think being consistent with
Yeah.
that routine is really important, whether it's a weekday or a weekend. And I know sometimes families have an event, and that's when everything kind of goes out of
Yeah.
whack. But and when you travel or you go abroad, I know a lot of families will travel with a lot of their stuff, the white noise
Hmm.
machine, and things like that to make sure sure that when they go on a holiday, things can kind of go off. But yeah, that's, I think, one of the things that I do recommend. We have another question right now. You mentioned the deficit in melatonin production. Is supplementation helpful for children with ASD? And so I would say, as a pediatrician, yes, if there is, so, I
Yeah.
have given quite a few talks on melatonin, because I feel like that has become like sleep medication that people are trying to use for their kids right across the board.
Mhm.
In general, I like to say that, look, the melatonin that is available over the counter is not FDA approved, not controlled. So when one melatonin has a dose of certain amount, another one may not have that. So they're all different dosages. We really don't know which dose is what. And so for general usage in children to help them sleep, I would say work on all of this first.
Yeah.
And then if the pediatrician recommends melatonin, that's fine. For children on the spectrum, however, I do know inherently they do have a lower production. And they are the children that after we've done a lot of this, we do, if there's anyone that I do recommend it
Mhm.
for, it is children on the spectrum. And we would
Yeah.
recommend that, again, based on the certain brands that we recommend, that, are known to have a certain dosage. But again, we do give that notice out because it is a hormone
Yeah.
that is produced inherently in the body, and you do not want to be taking something that is not officially prescribed. But another
Exactly.
medicine that is natural is magnesium glycinate, and that is one of the medicines, one of the over-the-counter supplements that I recommend, that even regular, other children, if they have a sleep
Yeah.
concern, they can take if they've gone through this whole process. It does have a
Exactly.
helpful,
Yeah.
sort of to help with that sleep.
Magnesium is something I always
Yeah.
recommend for people to include in the diet.
Yes.
So you mentioned protein,
Glycinate. Yeah.
right? Magnesium in at dinner time,
Mm-hmm.
always include magnesium, protein, yes, low sugars, right?
Yeah.
Or carbs, no screen time. And yes, I mean, for children in the
Yeah.
spectrum, uh, the thing is, and you said it, melatonin is not FDA regulated. There actually are no studies in children younger than 18 years old,
Mm-hmm.
let alone children in the spectrum,
Yeah.
right? And so
Mm-hmm.
we actually don't know for sure what happens, or if it actually helps or not.
Mm-hmm.
The thing is, melatonin, as you said, is a hormone produced by our body. So in my practice as a sleep consultant,
Mm-hmm.
I always work on helping, the child regulate their own circadian rhythm for them to be able to produce their own melatonin.
Exactly.
And so having a routine, a set wake up time, exposing them to sunlight in the morning, so 30 minutes right after they wake
Mm-hmm.
up, uh, a balanced meal, right?
Yeah.
A routine. I mentioned the routine throughout the day. That should help their body, anyone's body, produce their own
Mm-hmm.
melatonin, because that's where our circadian rhythm fits from:
Yeah.
exposure to light, our routines, and everything. However, in children in the spectrum, because they naturally have um, differences, right? Neurological differences, they may not be able to produce enough melatonin. And on those cases, after having tried
Everything.
everything
Yeah.
else, I always recommend, and when I work with families with autism, I always try to make sure that they have spoken with their
Mm-hmm.
pediatrician, that we are on the same page, not necessarily speak with one another, but
Yeah.
talking
Yep.
about with the family. And so if nothing helps, I would recommend, like, there are therapies like cognitive
Behavior.
behavioral
That's right. I was
uh,
gonna say.
therapies. I will
Yep.
go with that first. There are like bright light exposure therapies also.
Mm-hmm.
I've never worked with a family in that, but I know
Yeah.
there are available. But I feel like enough exposure during the, in the morning to the sunlight. Now, during the winter or in places where there is not a lot of sunlight,
Sunlight. Yeah.
maybe that could be a second option.
Hmm.
And then go into,
Medication.
supplements.
Right.
Exactly.
I totally agree. I think in general, and that's why I kind of call myself,
In
I mean,
general.
I think I'm a holistic
Yeah.
pediatrician, and
Yeah.
I actually even made a
I've
video
seen
of
you.
that.
Now you are a holistic
I was
pediatrician.
like, I am a holistic pediatrician who believes in evidence-based medicine, and I think there is a
Hmm.
lot of stuff in your lifestyle that you can do in general
Yeah.
that will make you lead a healthier life.
Hmm.
Just based on the way we eat, our eating patterns, our exercise, activity,
Activity. Hmm.
screen time, social interaction, sleep. All of these put together will help at the end. Another point I wanted to bring, because when we talk, and I know you had mentioned some of it with
Hmm.
regards to children on the spectrum being sort of, their kind of like sensory system is a little more. They may
Yeah.
have sensitivities to
Yeah.
certain things. And
Hmm.
so, again, those cues are important. But even in the bed, I think, just generally kind of, as you talked about, light, textures, the
Hmm.
fidget toy, the blackout
Smells.
curtains,
Hmm.
smells,
Hmm.
sounds, all of those things can potentially either make your child more wakeful
Yeah.
or help your child go to sleep. So I think there is a whole
In
list of
general.
different
Hmm.
things, right, that
Hmm.
parents can kind of work. And it's like not one size fits all. I think there are some things that you can do in general. Everybody should be doing it,
Exactly.
but you may need
Hmm.
to tweak it to your individual child. And I wanted to mention, because we were talking about this, I have one kid in the spectrum who's in my concierge practice. And I remember, I mean, the family, I felt, it was so hard because he was nonverbal, but the parents were not worried about anything else except the fact that that poor little boy would wake up at midnight every night,
Hmm.
and then he would run, and he would run in circles in the house for hours. And they had the hardest time trying to figure out the cues to create that bedtime, because they would
Hmm.
do a whole bedtime routine, not all the details, and we'd kind of worked, and I had sent them also to a sleep consultant. But the goal was, they tried to do a lot of the cues, but for some reason, if something woke him up, it
He
was
was
like
up.
as if he is now up.
Yeah.
And then the parents are like, oh my God, I have to go to work. And then you have this little boy running around. And it was like he was
Hmm.
just running in circles, and there was nothing that you could stop him. And so at the end of the day, exactly that. They kind of worked, figured out cues, figured out process to kind of try to help him get to sleep. But he ended up having better success with all the cues and some melatonin. And it was like, it made
Hmm.
a world of a difference, because once he started sleeping better and having that concrete sleep in the morning, the
Hmm.
parents were like, they gave me a call and they were like, oh my God, he's like a different child. Like he was
Hmm.
less cranky, less
Yeah.
irritable. He was willing to try certain foods. He was willing to do a lot of the stuff that he potentially wouldn't have, because
Exactly.
he was too tired.
And that's why
So
it's so important to offer, quality sleep
that's right.
because it changes everything.
Right.
Hmm.
It changes the whole program and stuff. Um,
Hmm.
Other questions. Um, One question that there was is, do you think a lot of these sleep problems in children on the spectrum, do they continue through adulthood?
Uh, well, I think they do.
Mhm.
However, I feel like in adulthood, people are, uh, it's easily, I mean, they have learned what
Oh,
works for them.
that's right.
And I think it does improve because of that, right? I don't know if there are neurological changes as, people
Mhm.
grow up, brain matures at almost 30 years old.
Mhm.
So really,
Yeah.
I think it's more about controlling the environment, knowing what works,
Mhm.
and having their routines and everything more set for them.
Mhm.
I think that is what helps.
Yeah.
They know how to control it. They know what works for them or what
Doesn't
doesn't. Right. So
work.
I feel that that's yeah, that's and probably sometimes in adulthood, um there's so many more factors as well. As they grow up and go to school, there's, I don't know, tests and
Right.
and
Yeah.
other things that they need to worry about. So I feel like perhaps there's always something they need to work on.
Mm.
Um, but I feel like there are tools available, and working with a specialist. There are sleep specialists for adults.
As
Again, I
well.
work
Yeah.
with children,
Yeah.
so always go find us some help there with a doctor, right?
And
I
work
feel
that.
a mental health provider also is a good resource for to have all the time for children or people in the spectrum.
Spectrum.
Mm-hmm.
No, while you were saying this, it kind of, I got another point that I was trying to,
Mm-hmm.
that you made me think of. And now I'm forgetting it. I was about to say something. No, yes, I
Uh-huh.
remember. It was basically having routines. So,
Uh-huh.
we talked about the routines and the cues. I always tell my families this. I said, we want to create good
Uh-huh.
habits from childhood because it is always harder to break a bad habit and it is easier to create a good habit. So, when they're small, and
Mm-hmm.
as I said, that's the thing. And, with kids on the spectrum, that's always been one of my big things has been that, and I just wanted to put that in there is, if families have children that have, you are concerned that there is, if you haven't got a diagnosed child and you think that your child is having certain, you have a baby that's not verbal or someone who's very significantly speech delayed or someone who's having, sort of extreme sensitivities to things like sounds, smells, light,
Mm-hmm.
textures, foods, having a very hard time sleeping, things like that. And that thought comes in your mind that could this be something else? Definitely bring it up to your pediatrician because, in general, the
Mm-hmm.
goal really is if you're worried about something, I really believe in being very proactive towards health. I think if you look into it, figuring out what's going on and getting the help your child needs earlier on
Mm-hmm.
has way better success outcomes.
Yeah.
Early interventions for children on the spectrum, the outcomes are so much better
Mm-hmm.
if started sooner. And so, typically, traditionally, if you are worried about something, it's always better to be able to reach out to your pediatrician, ask them for the information. If they're not able to
Exactly.
help you, at least they'll give you resources of where you can reach
Mm-hmm.
out to get that. But yeah, I think that is very important because again with sleep, another thing I wanted to bring out with, because sometimes the sleep, if you have children, often children on the spectrum may have sleep concerns, hard time falling
Yeah.
asleep, more wakefulness, not solid sleep. But
Mm-hmm.
again, it could be related to being on the spectrum, but it could also be related to other things.
Yeah,
And like sleep apnea, obstructive sleep apnea. And
that's
again,
true.
that,
Mm-hmm.
making sure that that has been looked into by your pediatrician. Is there any issues with the dentition? Is the airway too small?
Mm-hmm.
Is your child snoring, having apneic episodes?
Mm-hmm.
There's stuff that needs to be evaluated
Yeah,
and can be done by a specialist. But
exactly.
again, that would be stuff that you want to make sure you have that discussion because I think sometimes people blanket everything. Okay, the child is on the spectrum, so they will have sleep problems. Yes, they may, but we
Uh-huh.
also want to make sure we're ruling out anything else, right?
Exactly. And then in general, if for families that have worked with me, and if, anyone here wants to work with me at some
Yeah.
point,
Hmm.
I do start with a long intake form that
That's right.
includes questions that sometimes people like, why are you asking me this? Right?
Yeah. Right.
My child's not sleeping well. Why are you asking me if they sweat?
Hmm.
And so, because there are some signs from, for example, because you mentioned
There you
sleep
go.
apnea,
Yeah.
if they sweat a lot, if they go to the bathroom a lot in the middle of the night, or snore, right?
Hmm.
Things like that. Those are red flags for things like that, for
Hmm.
underlying conditions.
Right.
And so maybe, in addition to working with the environment and the habits that's what I focus on, I would tell them, hey, I recommend you to go see your pediatrician about this because just check their tonsils,
Right.
and adenoids and things like that. Or maybe low ferritin is, I don't know why it's so
Yeah.
common right now.
Anemia. Hmm.
Exactly. And that can affect the sleep.
That's right.
And so, yes, sometimes, okay, my child is in the spectrum. It's normal to have sleep issues, but yes, they can have something else
Yeah.
that can be treated and can
That's
help. And so
right.
in general, also for every child, when they have, you're trying everything and nothing
Hmm.
works, they might be something going on there that it's an easy fix,
Yep.
and just reaching out to your pediatrician. Again, when you have families with that, you can recommend them to go see a sleep specialist. And I do the same for the families I work with. For the sensitivities, occupational
Therapy.
therapists,
That's right. Hmm.
and then always, I think especially children with autism need a whole team of specialists or resources,
Right.
right? And so I, you know, encourage all the families to just have someone, even if you're not working full time with them, just have someone to reach out and ask these questions because they might be something a small change can make a huge difference.
100%. So,
Hmm.
I was, and that's where I wanted to also come in and bring up. So, when I do my autism evaluations, because I did a report on one of our patients today, that's one
Hmm.
of, so, if patients can reach out to me to get an evaluation, it is a package deal. We have no wait list.
Hmm.
We do a full evaluation. It's the ADOS, which is the gold standard. And at the end, the goal really is, and this is what I tell families, I said the goal really is to get an evaluation so that way your child can get the help they need to
Hmm.
thrive, right? So that's the focus. And that's my focus and that's the parents' focus. And in my report, that's exactly what it is. And before I
Hmm.
started doing these evaluations, this is what I would have loved to have come from somebody else with a full roadmap. And so that's what I kind of
Hmm.
create. And that's exactly what I do.
Yeah.
I come up with recommendations of therapy, whether it's behavior therapy, speech therapy,
Hmm.
occupational therapy, sleep consultant. Do they need to see a neurologist? Do they need to see a psychiatrist, a child
Hmm.
psychiatrist? Do they need to
Hmm.
see someone for pediatric physical therapy, for potty training? Do they need to see a speech therapist who focuses on food aversions and oral
Hmm.
therapy?
Yeah.
And do they need to see an ENT? Do they need to see a dentist? I mean, these are things that the pediatrician
Hmm.
typically would want to be the gatekeeper in doing all of this. But I try to create a nice roadmap because there are a lot of
Hmm.
people, traditional practices are very busy. The pediatrician has 10 minutes or whatever with the time in a traditional practice. And so often, it's sort of like, okay, let's get this when it comes up. I try to create a little roadmap so they actually have all of these recommendations
Yeah.
along with blood work. And part of the blood work is the ferritin and a CBC CMP and some genetic workup because
Hmm.
we want to make sure, because we do know that there is a genetic component to autism. If
Okay.
you have one sibling, there's another child that can have it potentially, or a parent, there's a family history. We are sort of looking at that. But that is part of what I give the families because then this way you have like something concrete along with resources.
Hmm.
So, a whole list of centers that they can go and call for therapy and call for occupational and physical therapy or speech therapy. So that way it's easy for the family. And a big part of my talk, and that's what I'm hearing from you, is
Hmm.
basically also really getting the family to understand that it is a team approach,
Yeah.
big time. Everybody, if we can get a team that will work together to help your child thrive, the
Hmm.
success is going to be much more. But
Exactly.
also for the families, finding other resource like community. Because I always say, I said,
Hmm.
you can talk to me, you can talk to you. Each child is different, and I have my resources. But if you're in a community with other parents with children on the spectrum, and the
Hmm.
spectrum, as we know, is wide, you may have another family that has a child that did something similar to what your child is doing, and they tried something that was safe and it worked. And maybe that's something, so you can kind of get more information.
Hmm.
And, I think it just as a community that helps, also supportiveness. And then
Yeah.
also for families to understand that when a child goes for therapy or any kind of intervention, it's not like, it's like school. When your child goes to school, they come
Hmm.
home and they have to do homework. That's how I
Yeah.
kind of look at it. I said, if your child goes to a therapist for anything, the goal is for you as a parent to learn that and then replicate that at home, because the therapist is not in your house, and the therapist is going to do
Hmm.
have their limited exposure to your child,
Hmm.
be it working with a sleep coach or with anybody that's giving you recommendations. It's basically replicating that repeatedly at home, because that's how the children
Hmm.
sort of learn. Every
Yeah.
child, you're kind
Every
of
child.
being consistent. Yeah,
Hmm.
you're being consistent with processes. I think that's how I kind of look at it.
Yeah. For children, especially in the first 5 years of
Yeah,
their life, they thrive on routines
big time.
because it it reduces any stress or anxiety,
Hmm.
right?
Yeah,
We as
yeah,
adults, we already know what we're supposed to do when we wake up, right? We have our tasks for the day, work, drop off, pick up for
yeah,
me, for me, for example, right? Walk your dog, etc.
yeah,
Kids don't know that.
hmm,
They rely on the parents. So
yeah.
it's our job as parents to uh, you know, draw that map for them.
Right.
And that map consists on routines so they can anticipate what's going to happen, reduce those
That's
anxieties,
it.
and then that is what also strengthens the
Hmm.
trust between the caregiver and the
That's right.
child, because they know that the parent will offer what they need,
Hmm.
and they will just feel more um, confident.
Right.
They will feel confident in going to
Hmm.
school, just meeting other children, or adults, right, or their teachers, they will feel more comfortable because they trust that their parents will be there offering what they need, whether that is, you know, just a visit to the pediatrician when they're
Hmm.
hurt, or a mental health provider if, they're dealing with something, or working on the sleep with a sleep specialist, because they can see that, they're offering everything they can, but there's something wrong, not wrong, but an
They
issue
they
going on
need to
there.
help.
They can identify, right?
Right.
There's
Yeah.
a better communication between the child and the parent, and they can, bring that to any specialist they need to. And then that's how the child thrives and becomes more confident as they grow up as an adult.
Right. No, I totally agree with that. I mean, we, in general, I mean, I've always recommended routines. I think I work very well. It's like
Mm-hmm.
executive functioning. It's like, we learn how to process things, and we
Mm-hmm.
work better because you have a day, and if you know what's coming next, you can prepare for it. And
Mm-hmm.
exactly as you said, it decreases the anxiety, even for a child, because they
For a child.
anticipate and they
Mm-hmm.
prepare themselves for it because they know when it's meal time, so they need to kind of start thinking, okay, now I gotta go eat, or it's
Mm-hmm.
evening, I gotta go take a shower, I better go do this before
Mm-hmm.
somebody gets upset. You're not gonna have little dirty children go to bed. Well, sometimes you have to. I mean, like sometimes you're like, okay, well, you know what, you made this choice, but kind of having that, and I think also communicating, what's
Mm-hmm.
coming next. So, you're kind
Yeah.
of having a routine, but then communicating it. It's like when,
Mm-hmm.
and I know this is off topic, but when we have parents will often ask me, when we go somewhere, and it's time to leave, especially children, little children, and they're having a good time. And that could be
Uh-huh.
for any child, right? The transition from having a good time and now it's time to leave. Now, if you
Mm-hmm.
tell any child at certain ages, I think actually, I don't even think any ages, anybody, even if I'm in the middle of having a really good time and then suddenly someone comes and tells me, we got to leave right now, I'm going to be like, what?
Yeah.
No, right?
I
But
don't
when
want
I,
to.
when,
Yeah.
right, but when somebody comes and tells me, okay, warning, we're going to leave in 5 minutes. So what it does is it gives me the opportunity to kind of complete what I'm doing, potentially mentally prepare myself. It's
Mm-hmm.
time for me to go. And then you kind of sort of prep. So when it's actually time to move on to the next activity or whatever it is, you're more likely to do it
Mm-hmm.
than someone who wasn't prepped, I think.
Mm-hmm.
And I think that's also very important for kids on the spectrum. And it may
Yeah.
take longer, right? So, as you said, like we talked about the process of the sleep process and
Mm-hmm.
the different things that happen and we need to do. Some kids are really quick and some kids take a little longer. And we take
Mm-hmm.
all of that into consideration to make that going
Yeah.
to sleep process more, less stressful.
Less
Uh,
stressful. Yeah.
yeah,
And
because
yeah.
no, no,
Sorry, I interrupted.
I was just going to say at the end
Uh-huh.
that, because I think anything that makes it stressful, raises up the anxiety,
Yeah.
and takes that whole process even longer. Oh, what happened here? Why am I?
You did that.
I'm sparkling.
You're
Oh,
celebrating.
I celebrated something. What was that? Okay, that was not
No,
me. That was Instagram doing some sort of hip hip hooray.
they like what you said, because
Oh,
it
really?
is, it is true. No, I don't know. It just,
Because
it
I
was
did not
your
touch the
expectation.
screen.
I was like, whoa. No, but yeah, I mean, what you said, it is, everything you said is important. Also,
Yeah.
there's another component that I forgot to mention, the temperament. Each child has
Yeah.
different temperament, and
That's
each
right.
child, you know, uh, may have different ways to process transitions,
Mm-hmm.
right? And
Mm-hmm.
some kids are more goal oriented, so you have to find something that works for them, make it a challenge for them.
Right.
So to and but then other children are just more mellow, they transition easily, so you don't need a lot of incentive, right?
Mm-hmm. Yeah.
So that's in general for
Enjoy.
every children,
Yeah.
every
Every child.
children,
Yeah.
right?
I
So
agree.
children in the spectrum, they also have their own way of processing change
Mm-hmm.
and transition. So
Yeah.
you have to find what works for them specifically. Sometimes it's visual, sometimes you can add incentives, rewards. If you do this in a set amount of time, you get a sticker
Yeah.
or something like that. A
Yeah.
sticker chart works wonders in children with
Mm-hmm.
autism. So sometimes as parents, we're so overwhelmed,
Yeah.
right, with what's happening in our day to day,
Yeah.
and our creative side is non-existent
Yeah.
sometimes, and
Yeah.
during the
I,
day. So especially for a parent of a children in a spectrum, I really encourage them to find help. You know, for me, like the help that they get from working with a sleep specialist is finding, giving you so many options that you can relax and just choose, or even just try this for a week. It doesn't work. Let's try something
Right.
else. And having some guidance when you are trying to implement something for your child, whether they're in the spectrum or not, really.
Right. Yeah. Like a
Sometimes you
cheerleader.
just need,
Yeah.
yes, you just need accountability also. Like,
Yeah.
hey, just someone checking on you.
Yep.
How was last night? Did you try this? No, it didn't work. Okay, why don't we, give it a few more days or try something else, right? Because every child is
Right.
different. And so, and I told you this last time I saw you, I started doing here in Houston, I started doing in-home sessions
Yeah.
because the environment is another big factor when it comes to sleep. So especially for children in the spectrum,
Hmm.
I would recommend, if there's families here in Houston that need help with sleep,
Yeah.
to do the in-home sessions so I can go assess,
Right.
give, real-time feedback on things they might change. Like, for example, in the case that you were talking about, that child that woke up to run around in the house,
Hmm.
maybe environmentally he needed a different room, block out sounds, right? Maybe he was too close to the street. And so those sort of things are, but sometimes you need help to
See
detect
it.
around
So
your
yeah. So when you're
your
saying
house.
this is what I
Hmm.
was going to bring up, because when I so in my practice, it's like in person. So they come to me
Hmm.
in my office. This is my
Hmm.
PD room. And then I do televisits as well. And
Hmm.
one of the great parts of being able to do a video visit with
Hmm.
families is I'm actually seeing them in their home,
Yeah.
and I am seeing them in their environment. And
Hmm.
people often are different when they're in their own environment, but then you can also kind of assess what's going on. And you're very, very right. When
Hmm.
I have done, so when I do my autism or ADHD evaluations and I'm walking through lifestyle and I'm asking
Hmm.
parents specific questions. What does the
Hmm.
child eat? When are they eating? And I'm asking
Where?
specifics.
Yeah.
It's
Where do
actually,
they
break it
sit?
down.
Yeah.
Right. Where
Hmm.
are they sitting and eating? What does the food eating environment look like versus where are they studying? Where are they working? What is their sleep environment? And specifics. It's not a general thing, this is what you need to do. I'm actually asking them, what do you do? And then
Hmm.
I give you solutions. I'm
Hmm.
like, okay, so this is what's happening, and I see that maybe this could be a problem. Here, try
Hmm.
this, try that. Because then
Hmm.
you're giving like very special, specific
Specific.
information,
Yeah.
right, to their particular
Hmm.
environment. Because there's a lot
Hmm.
of information available of do this, do this, do this. And a lot of parents think they're doing a lot of those things. But when a third party specifically asks, like when I ask, what the child's diet is like, and my parent tells
Hmm.
me they're eating really good. And then I'm like, okay, so what do they eat for breakfast? Bread and
Uh-huh.
butter. What do they eat for lunch?
Awesome.
Bread and butter. No, bread and butter. And then what do they eat for dinner? Bread and butter and jam. Okay.
Uh-huh.
So
So
you
they
know what
don't
I
care.
mean? Because
Yeah.
so
Yeah.
and maybe they'll eat like one carrot, or they'll have like, so I'm just, this is just an example. But what I'm just saying
Hmm.
is when you specifically ask and you actually do like a
Yeah.
nutritional history and stuff specific to that child, then you kind of start to pick up, okay, maybe your kid's not getting enough this
Hmm.
protein, or not
Or
enough, or
vitamins.
too much
Yeah.
sugar, or you're having like colored drinks, or you're taking too much
Hmm.
milk, or not enough water, or when you think your child is exercising enough, that's not really counted as exercise. Or
Hmm.
when I'm saying limit screen time, what exactly is screen time in your house? And they're like,
Hmm.
well, when they're on their phone. Okay, but what about iPad? Oh yeah, they're on the iPad for 6 hours. I'm like, no, screen time is anything that's a screen. So you know what I mean?
Yeah.
Specifics. And I see exactly what you're saying. When you go into the house,
Uh-huh.
you're physically seeing the environment and saying, hey,
Hmm.
you know what, this might be a good fix. And
Yeah.
you can actually give them specific
Specific.
solutions and stuff like that.
Exactly. Yes, and you have to make a lot of questions, and that's why, you know, there is a lot of information
Yeah,
online, and there are
I agree.
books. You
Yeah.
can read all the books. I read all the books.
Yeah.
What I offer, the families is actually
Experience.
a tailor.
Yeah. Yeah.
Yeah,
Yeah. A
it's a
tailored thing.
tailor
So tell
thing.
us a little
Sometimes
more.
yeah.
Sorry. So tell us a little more about how, if somebody needs help
Mhm.
with you, how would they reach you? And
Yeah, so you can just go to my website. It's in my bio. and I have different packages there. So I can do just one consult, like a telehealth consult online. If you're in Houston, I can go to your house and do an assessment. Again, I mentioned before, I ask for an intake form. It's like 9 pages long.
Yeah.
It includes a lot of questions regarding different things, even like the mom, even about the mother and what they do, their routines, their milestones, when the baby has reached certain milestones, depending on the age. So I can kind of get the general picture. But then during the session, whether it's online or at their house, I ask even more questions, more specific questions about, even when, like you said, when do they eat, where do they eat, what time,
Right.
is who takes care of them during the day, etc. Like, so their whole routine. We talk about environment, we talk about their schedules throughout the day, and we implement a plan to, as a goal, teach the baby or the child independent sleep. Because when they come to me, is because the baby for some reason is not sleeping through the night, or have a strong dependency on something, whether it's breastfeeding or rocking to sleep, etc.
Right.
Or just holding the mom's hand, things like that,
Yeah.
that the parents have not been able to find a solution.
Right.
And so we talk a lot about, the baby, what they like. So I try to get to know the baby and the family, really, the family, so I can offer a tailored solution to their issue. And then we decide how long we're gonna work together. Because sometimes it's an easy fix, okay? Um, but then I've worked with families for 6 months with weekly calls because they needed, a lot of changes. And my approach is a gradual approach. So we try to minimize crying. We try to make the child and the parents comfortable with the plan. And so that entails a gradual plan, no drastic changes, because that raises anxiety and stress in both babies and parents. So we want to work together, building connection, strengthening the bond between the child and the caregiver. I also try to help them get to know their child better, so they can have the tools for later, for when they're not working with me anymore. They can still troubleshoot, right?
Yeah.
Because babies, they go through so many things, that regressions happen. Regressions happen. Sometimes they get sick. Sometimes they're very sensitive. Teething bothers a lot, and so they tend to go back to, what they
Have
what
done
was happening
before. Yeah.
before.
And your company is Easy Nights
Easy
and the
nights.
website. And so basically they would basically reach out to you via phone number or email, right?
Yes,
Okay.
email, and
In
my packages are all in my website.
website.
But
Perfect.
you can also schedule a clarity
Yeah.
call, just
So
15
free.
minutes
Yeah.
call to figure out what you
What you
need
need.
specifically, and I can recommend the right package for you.
Right. And so I know there was a mom who
Yeah.
asked, do your practices accept private insurance?
hmm
So
Yeah.
you need
Well,
the
in my
service. Yeah.
yeah,
Yeah.
no, in my case, it I don't, but I do have a range of packages. And we
Yeah.
can
For
talk
different
about your
pricing. Yeah.
specific needs,
Yeah.
and yes,
That's right.
specific pricing. And
That's right. No, that's amazing. That's amazing.
Mhm.
And again, for my practice, I was just going to put out over there. So again, I have, it's like two different things. I have my
Mhm.
concierge practice, which is a monthly membership based practice.
Mhm.
And again, most of our patients have insurance. I have patients who have commercial insurance, Medicaid, or no insurance. We don't bill insurance. What happens is the parents pay a low monthly membership to get all the perks of seeing the doctor, seeing me, getting the appointments, getting long appointments, be
Mhm.
able to get the text access. And so they don't have copays or deductibles. And parents love it because, our pricing for the older kids is 125 a month. And often when you go with insurance to a one-time sick visit, it's sometimes 200 plus for just one visit with
Yeah.
your copay and your deductible. So here you have, it's like the Netflix of healthcare is how I look at it. You
Yeah.
pay a monthly membership, but you
You
get so much, and
yeah.
the focus is to keep the kids healthy. And I think that's my
Exactly.
very proactive
Mhm.
approach. And again, it's pediatric pod concierge, pediatric pediatrics. It's the Pediatric Pod is the website. I'm on pretty much on all the Instagram, Facebook handles. I
All
put
the
a lot of
socials.
free videos. And then also for the autism and the ADHD evaluations, we do packages. And again, the focus really is getting that evaluation done quickly. And I think a lot of the times we have no wait list. So I don't believe in wait lists.
Mm-hmm.
When families call, we open up spots and we get them in. And the goal really is get that evaluation done quickly. So that way, if your child gets a diagnosis, they can start their therapy sooner.
Mm-hmm.
And so I think that's why a lot of parents choose us. We've had parents who have reached out and then got on a wait list to use their insurance, waited a year plus,
Mm-hmm.
went with their insurance and ended up getting a bill that was double what they would have paid us because they didn't realize that even with insurance, when you have insurance, you really need to see if you have a deductible. Because if you have a deductible and your deductible isn't met, the insurance doesn't pay until you hit your deductible, which means
Yeah.
the negotiated rate at that practice is what you are going to have to pay. And I had two or
Mm-hmm.
three families reach out to us. So whenever anyone calls us and asks, and we're like, we don't take insurance. This is what the way we work. But if you're planning to wait for your insurance, please call your insurance, see
Mm-hmm.
what that price is going to be, so that way you're really making informed decisions when you're waiting a year and a half out for an
Mm-hmm.
evaluation. So yeah, I think that's how I kind of
Yeah.
function. And again, I think
And
we have a
that's
similar approach. It's sort of
exactly.
proactive care, preventative
It's
care.
preventative care.
Yes.
I do offer also like classes for expecting
Mhm.
parents,
Yes.
visits
Yeah.
with newborns.
Yeah.
And so I offer a 6 month package, a 3 week package,
Right.
just one consultation. I also offer like a
Yeah.
1 day um, personalized plan.
Yeah.
They send me the questionnaire and I send them my recommendation. That would be my cheapest option. And I try to do this because I know, families have different
Yeah.
situations. And sometimes, even though they need the help, they may not have the resources right there.
Right.
And so
Yeah.
I want to be able to help them
Yeah.
as much as possible. There are families that, really like to have the concierge
Yeah.
experience and have, the
Mhm.
6 month package with you. They can connect with me via text or WhatsApp and, unlimited calls with me
Mhm. Yeah.
to be able to implement things, troubleshoot as they go, right?
Right.
But I do offer the more accessible options for families that really need the help,
Yeah.
but they cannot commit to
A
a
long term.
6 month
Yeah.
plan. Yeah. Mm-hmm.
I think the both of us sort of are kind of looking at it to try and help the community. I think that, the goal really
Yes.
is there's a lot of information out there, a lot of misinformation. I also think
Yes.
there's a lot of need.
Mm-hmm.
I think sometimes people think that we using something is more beneficial and
Mm-hmm.
may not be. And so
Mm-hmm.
really kind of getting that information out there to provide a lot of making informed decisions, good
Yes.
information out there in the
Mm-hmm.
community so that families can make good informed decisions.
Mm-hmm.
But we are actually now at the 12 o'clock
Yeah.
hour.
Mm-hmm.
So this was really great. Thank you so much,
Thank you for having me.
Alejandra. No,
Yeah,
this was excellent. I hope it helped some of our families out there. I will go
absolutely.
ahead and share with on YouTube as well. But thank you
Mm-hmm.
so much for being here.
No, thanks for the
And it
invitation. I had so much fun, and I
was really
could
fun.
talk about this
Yeah,
the whole day. I could
I,
talk about this the whole day.
yeah,
I
I
really
agree.
like that, and I enjoyed answering the questions from
Yeah,
the
from
families here.
I think that was great, and hopefully next time we'll have. I'm going to try and do a couple of more, and maybe we'll do one in the future for our babies and stuff like that.
Yeah. Also, before we leave,
Yeah.
I'm also starting like a group
Mhm.
coaching for six. If you have a child 6 to 12 month old, I'm gonna help families regulate the circadian rhythm. I've
Oh,
talked about a
nice.
lot
Okay, cool.
during this talk. So we're gonna work together so their babies start sleeping better
Better. Yeah. I know.
naturally,
Start early,
right?
right? Start
Start
early. Make it easy.
early. It
Make
start
life easier
it's
for
easier
everybody.
because that age range are usually, they're usually not in school, some
Yeah.
are in daycare, but I mean with the naps and everything it's easier
Yeah.
to help them regulate that because that's when good sleep starts with
Starts.
a good regulated
Right.
circadian rhythm.
That
Hmm.
is true.
Like
Well,
our
thank you
internal
so
clock.
much. Thank you, Alejandra. And I am going to now log
Yeah,
off.
thank you.
All
I
right.
had
You take
fun.
care. Have had fun.
Bye.
Thank you. Bye.